Hi, I'm Sarah Schulz, and this is People Over Politics. I'm a committed community member as well as a candidate for the 98th District, which includes Midland and Bay counties. Today we'll be discussing the shortage of mental health services and mental health providers and the impact it has on the lives of our community members. The community members that we have here today are Ricky Shook, Monica Hughes, Judy McAtee, who is a licensed clinical social worker with over 30 years of experience, and Christopher Morabito, who is a licensed professional counselor with Midland Psychological Services. Welcome to you all, and thank you for your time to spend here. I really appreciate it. So, Ricky, why don't we go ahead and start with you? Can you tell us about your experience getting mental health services for you and your family recently?
Yes, so I recently had my second child. I am a mother of two, so my first is 5, my second is 4 months. I started experiencing anxiety when I got pregnant. It was pretty escalated, but I thought at the time it was due to the amount of work that I was doing. So my workload was pretty heavy. I was in a more demanding job than with my first. And so I kind of thought, well, once I go on maternity leave, it'll be okay. It wasn't. So after I had my second, I was getting ready to go back to work. I was dealing with having my first, and I started realizing that the anxiety wasn't normal. It wasn't something that I could self-manage, and it was negatively impacting things. And so I decided to talk to my OBGYN, and they recommended talk therapy first. So they said, we could put you on some medication, but we think maybe you could talk through it. And so when I started my search in the Midland area, I was really disappointed in the lack of postpartum anxiety counselors in the area. Actually, every place I called, most of them said, well, we had one, but she left, or, ours retired. So there seemed to be just kind of a lack of that in our community, which was disappointing. But I was like, okay, well, I'll just take anyone that can help me with anxiety. And most of the centers were at least 2 to 3 weeks out. So that is hard when you are trying to get help for something and you've been gearing yourself up for so long to seek the help. I was like, okay, I'm ready, but nobody else was ready for me, which was kind of disappointing.
Yeah, sure. And you're saying that through all of this, there were some negative impacts on yourself, maybe your family. Can you talk a little bit about what that was like?
Yeah, so, you talk to your husband a lot, and he was like, well, it's going to be okay. And I was like, well, it doesn't feel okay to me. So a lot of it was, impacting, like, me and my thoughts of how I was as a mother. So, I could fake it till I make it, but to a certain extent it was, how do I get around? It just felt like monumental, like getting up, getting the baby around, getting my son to school, that all just felt like too much work. Yeah. And then I was going back to work. So when I started to seek help, it was about 2 weeks before I was actually going back to my full-time job. And that alone was like, getting up and getting the kids around and going to work, I was like, I don't think I can do that. So I really just needed someone to help me through that. And that was where I kind of felt short. I finally did get on a cancellation list with somebody and was able to find a therapist the week that I went back to work, which was very helpful. It just seemed like every place was full. There wasn't really anybody for me. So I think that's kind of where it felt short for me.
And you were eventually able to get the services that you needed?
Yes.
And how old is your little one now?
She's 4 months.
Okay, good. Awesome. Well, thank you so much for sharing that. wonder, Chris, if you could chime in a little bit around, as a licensed counselor, maybe if you could share with us what it takes for someone to get mental health services in our community with and without health insurance.
Yeah, well, without health insurance, it's very challenging because you're going to have to pay out of pocket, and I think the going rate is usually around $100 to $120, even $150 an hour without insurance. So that's a huge expense on anyone's part. With insurance, the good thing about social media is you can always Facebook or hopefully look at the areas that do accept insurances, and try to find the person that's right for you, right? I mean, I think the biggest thing when searching for any therapist is that you can connect with them, you can work with them, and I think that's going to obviously bring the best therapeutic benefits out of any other type of option.
Yeah. I wonder if in your experience, can you share any stories of individuals or folks that you typically might see that maybe have had some challenges with the services?
Yeah, and specifically, when we talk about that, something that comes to my mind was when I was working in Saginaw, especially during the opioid epidemic that we still see going on today, and working in substance abuse. We would have kids come in that had addiction issues, and because they had kind of private insurance, their insurance would guarantee them 5 days in rehab. And I mean, hopefully most people know that you probably need more around 60 to 90 days to get maximum treatment benefit out of a rehab. But 5 days, I mean, it's really challenging for them, but also as a therapist to have to come and talk to these parents saying, it must have been a lot to bring your kid just to get them in to accept treatment, only to say 5 days from now you have to come and pick them up, and then what's really the benefit out of that? That makes it very challenging, I think, for anyone in that situation.
And in a case like that, what would happen after those 5 days?
Yeah, it's what's going to happen is probably they're going to go home probably, and they can either overdose probably and then go into the hospital and start the process all over again. And the sad thing is when we even have that dialogue with the insurances, sometimes they even want to see kids go through outpatient first, even before they go into a residential setting. And that's kind of odd for at least my perception on the mental health, because the drugs they could be taking or even the mental health issues they might be dealing with might put them in a dangerous situation if outpatient therapy is not the correct level of treatment for them, like in inpatient rehab, where we know there's doctors on staff, nurses, therapists, 24 hours, they're safe, and that brings a lot of relief to a lot of the family members who are struggling with someone with an addiction.
Yeah, it must be really frustrating to be in a position where you're providing support to a patient and you know what they need, and yet you have barriers around the insurance and other things to be able to provide those needs.
Absolutely.
Yeah, for sure. So we did some research on the team, and we discovered that in fact there is a really big issue of scarcity of mental health services. And in fact, in 2019, it was estimated that 650,000 Michigan residents with mental health illnesses are not receiving treatment. 650,000 residents in Michigan. 65% of the uninsured and 49% of Medicaid patients don't receive mental health treatment when they need it. That's huge, huge amounts. There are several barriers to care, but one major barrier is the provider shortage, kind of like what we've been talking about, especially in the northern parts of Michigan, those rural areas, which Midland and Bay County are kind of right on the cusp of those northern areas with needs. Mental health providers include psychiatrists, psychologists, licensed social workers, counselors, marriage and family therapists, and other substance abuse providers. And of the 83 counties in Michigan, 33 of them have no psychiatrists, and 10 of them have only one, and those are mostly in the rural areas. We're lucky in Midland. We do have some options, but our rural neighbors can add to the number of people who need care here in Midland, and add to the trouble of Midland and Bay residents finding care as well. Judy, I'd love for you to hear about your experience with the shortage of the providers.
Yeah, as you mentioned, psychiatry specifically has an incredible shortage. Psychiatrists tend, as a rule, to sort of stay in the area that they received their background, their training in, which is usually the bigger cities. Ours are saturated in Detroit, in Michigan, saturated in Detroit and Ann Arbor specifically. There are people who wait months to get in psychiatry. And as you were mentioning, when a person really wants and needs a service, they really often are desperate. They've kind of put it off for a while. They need it now. And then to be told that you have, you know, a months to weeks wait list, it's not uncommon in practices here in the Midland area to have to wait 6 to 8 weeks to see a counselor. That's just counseling alone. Psychiatrists, it's even worse to try and find a provider here. I had a client, a child that we referred down to U of M for a very specific reason, and that wait was 8 months. So an 8-month wait.
8 months.
And so, as you mentioned, well, what do you do in the meantime?
Right.
Families struggle trying to piece it together with their own knowledge or at home or trying to work with schools. But we're not equipped. We don't even have really social workers in the schools anymore. That and then the psychologists are spread among many schools. So there's a shortage all the way around, changed over the years as far as where we can get those services.
Wow, that's too bad. And I know that, Monica, you have experience with this sort of getting access as someone who needed services and getting access to those services when you were uninsured. Can you talk a little bit about that experience?
When my husband came home a few years ago from Iraq, he came home with PTSD that affected our everyday lives to the point where he couldn't get a job even. And when he came home, I was, of course, with our second child, and I was struggling with postpartum depression, anxiety. My parents had just recently divorced, so I was struggling pretty bad to the point where I was even suicidal. So I reached out to our local community mental health, and it took forever to get an appointment to get assessed there. And when I got assessed there, they actually told me that I was borderline and that I could not receive services, and since I didn't have insurances, that I could not afford a health, you know, a psychiatrist at that time. And with my husband just getting, you know, the Michigan unemployment, there was no money even for a sliding scale therapist.
Wow. Wow.
That brings up, you know, a whole different element of services. I know that Chris mentioned more private practices, but when you're, you know, uninsured or underinsured, or you know, you have to use the governmental services, which are there for that reason, but they have had so many budget cuts and so many changes that it's very difficult to get in. And they've had to actually, even if you have had any insurance, they've had to open or close those doors to those clients because of their budget cuts and put them back out into communities looking with private practices.
Yeah, and just to comment on that a little bit, like, you know, going back to the rehab situations, we've seen those governmental insurance, you know, provide long-term care for clients that needed it in rehab services. Like any type of governmental insurance that we saw would almost guarantee you 90 days in a residential stay, which is that time you need, plus services after that, compared to what we'd see in other competitive insurances.
Yeah. Now, Monica, were you eventually able to get the services that you needed?
So, funny story, I ended up having to get cancer to actually get approved to get services.
Wow.
So I would say I was able to actually get health insurance and get the help I need through CMH. They actually said now I'm above, but maybe they also have different procedures to where they're examining more of your background. And I'm really appreciative of everything that they've done for me and are still doing for me, because I was a mess before.
Well, I'm really glad that you were able to get the services that you need for you and your family and your beautiful kids who are amazing. Judy, you've been a clinical social worker for many years. Tell me some more about the concerns that you think about when you hear these stories.
Yeah, I've seen a lot of change over my 30-plus years as a practitioner. But, you know, waiting to receive services 6 to 8 weeks is just too long for some people. And unfortunately, what happens then is they get into a crisis situation, or into, you know, through a back door, as she did with her cancer, unfortunately. But what's happening is we're seeing people show up in the emergency rooms, or they get and wait for so long that they get into a crisis, and therefore now they have to be hospitalized, which is a real That's very taxing right there on insurances. They're paying more now for inpatient facilities and rehabilitate services, where had we been able to get services early on, we could have gotten that support, that network going with them to start working on their issues before they became so acute and so drastic. Some of the other things that we're seeing in our office is I think it was 40% of people that say that the cost of these services is one of their biggest issues. Of course, it increases as you even go up further north in Michigan. But you know, a copay, a lot of young families, they're healthy, they take out a care plan if they don't have one through their work that covers their physical health. But currently we have health insurance plans that don't cover behavioral health. So they don't think, we're healthy, we don't need insurance, but now they have some depression or they have a child who's experiencing anxiety, and they take out a high deductible copay. And so they just are not even wanting or able to, not wanting, but able to come in and pay that high cost, as Chris was saying, for a private practitioner. Or they might say, I can only come in once a month. Well, that's not going to be to their benefit either.
Right.
So there's been a lot of change over the years.
Oh my gosh. Well, and when you mention cost, I also think about that statistic we talked about where there are 33 counties that have, you know, no providers, right? So just the cost of the transportation to see a provider can be prohibitive. Yeah.
And in the rural counties, we have people that don't even have the income to, you know, pay for their car insurance, let alone be able to pay for the gas to drive down. It isn't unusual for me to see clients from Tawas, from Gladwin. We are seeing a lot of people coming from the northern counties driving all the way, but then again they limit how often they can come because they can't afford the gas and the time to come down.
Right. Wow. Well, I'm sure that all of this, of course, has impact on individuals, but, you know, I'm thinking about the impact that this scarcity has on our community, right, and our society as a whole. You know, the impact we mentioned to our hospitals and our emergency rooms, to our jails, you know, that sometimes jail can be the inpatient, you know, availability of services that's there. I think about increases in disability, right, related to mental health, and just people just not being able to reach their full potential because they, maybe as young people or even, you know, as older adults, are not getting the mental health services that they need, so they can't hold down a job, they can't sort of go to school, they can't take care of their children, and they and their families are not able to reach their full potential, which also, of course, impacts our community. So I want to turn us now to solutions, if we can, if y'all don't mind, move into that. So some possible solutions that we've sort of been talking about are, one, to increase the number and the retention of behavioral health providers, right? So if we're talking about scarcity, how do we increase the number of people who are providing this service? And actually, there's a couple states that are doing some promising initiatives in those areas, right? One of them is California, one of them is Colorado. They're doing some things that are related to this, things like implementing residency programs specifically for rural areas. Job shadowing, when you do job shadowing programs in psychiatry, you actually increase the number of folks who are interested in going into that profession. And also one thing that I think is really interesting is these states are working on paying off student loans for people to go work in rural areas, right, where the real, a lot of the gaps are. So those are some ideas. Does anyone else have any other thoughts about that?
For psychiatry in particular, I think we need to start looking at breaking down some of the barriers that keep telepsychiatry not being able to be implemented, especially in the rural areas where patients can't come down to see their psychiatrists. It's proven really beneficial in the rural areas for the telemeds. So, but psychiatry specifically, when there are no psychiatrists in these rural counties, to break down some of those barriers with the insurance companies and.
I imagine too, just with the telemed or telepsychiatry, particularly in some rural areas and in areas in our own community, Wi-Fi access is actually a challenge, right? So how do you have access to telepsychiatry if you actually don't have a Wi-Fi connection to be able to do those video conferencing and conversations that I'm sure are so necessary? So.
And I did look into those solutions, you know, when I was looking because of the lack of providers in the area, but they were much more expensive, and they didn't take my insurance. So you know, and it was
true.
like with the price and not taking my insurance, I couldn't justify it at the time.
Well, and even like I remember working in rehab, and we were trying to get therapists and even psychiatrists. That service in itself is a cost for the company itself, right? So there's like a double-edged sword with that. So yeah, there is that expensive factor, but you do get to expend and the reach of what you can get for sure on that.
Yeah. And especially, Ricky, I know you were looking for a specialist, right? In postpartum anxiety, and that was part of your challenge too, was that you locally you couldn't find that specialist. So that was, if telepsychiatry was an option, then you might be able to have the specialist that you're specifically looking for.
Right.
And it would open up more possibilities than just who's in this local community to be able to provide that.
Yep.
So. Go ahead, Chris.
Oh no, so like just other solutions, like I guess on a positive note too, always being the advocate for mental health, in the community and as a society in general. I mean, I was born late 80s, grew up in the 90s, and like even from then to now, I think we've seen a great increase on the acceptability of mental health. I mean, I remember growing up and watching movies, psychiatrists were always that creepy bad guy in the movie, but nowadays we're people are starting to accept that and say, hey, it's okay to get mental health, or making it a common thing just like as it would be for physical health. I think that's something we can all work on and improve on in society to help these services. Would you agree?
How do you think workplaces factor into that too?
True.
Do you mean like workplace insurance, or?
Yeah, well, I mean from the standpoint of like the workplace advocating for the mental health, because I think they've started advocating more for physical health because they've seen that lowers their insurance costs. But I'm wondering on the mental health side if that's a factor, if they could possibly help positively influence
I'll speak for my own organization, as I'm an HR person in my organization. We rely heavily on our employee assistance plan to provide those types of services, because we do recognize, particularly the work that we do in really high need schools, that it is a very challenging work environment, and we need more than just your sort of typical health insurance to be able to provide what we need for our employees and our core members to be able to do that work. So it's really important, but you're right, I think that employers we're behind the curve. We've recognized the need for better physical health for our employees. It's a bottom line issue, right? But mental health is also one that we need to do a little bit better job with.
We are seeing with more work from home programs, many employers now are encouraging work from home, and it does save them some cost, but it also helps, especially people who are suffering from pretty severe anxiety and going into the workplace. Being able to work from home and be free is really a big benefit.
Yeah, for sure. One of the things that I think we've seen even more and more in our local community is when you combine the physical location of both mental health services and physical health services, then you're doing it all in the same place, so you're kind of reducing some barriers and some stigma to that too. So I'm really appreciative of some folks who are spearheading that type of effort in our community. It's really cool.
I've also noticed that doctors are actually starting to ask more about mental health. Like there's actually checklists and stuff now. I just wish that when they gave you the paper of what psychiatrist or therapist took your insurance, that they actually did take the insurance. Like sometimes when they give you that list, you call these people and you just get frustrated because you're like, they said they took my insurance, but they're not doing it anymore.
The list is out of date, and I understand that's very frustrating. Well, I think whatever we can do to reduce that stigma, right, can really help, because it's probably a self-fulfilling prophecy. If more stigma means less going to the, get services, meaning more need for services, meaning more stigma, and then it just becomes this sort of spiral. So I was going to mention that there are some bills that are making their way through the legislature in Michigan. One new bill was actually just introduced in January. And I think we'll touch on some of the issues we talked about, which requires health insurance companies to include in all of their policies coverage for mental health treatment. So that was introduced in January. It would be amazing if we could get that passed. This bill would also prohibit requiring higher deductibles or copays, or it would also prohibit providing lower benefit levels, right, for folks for mental health services. So there's some, as always, right, this is a partnership with our lawmakers and our leaders and our local providers and our community activists to make this work. So, all right, well, our time is almost up. Does anyone have any last sort of thoughts or ideas that they'd like to share?
Well, I think there is hope. I mean, I think we need to look for some hope in this. And just one, you know, we talk a lot about how the social workers and psychologists have been taken out of the school. I was really happy to hear this year in Midland, one of the schools actually did provide a support group for some of the students that were suffering from anxiety and depression. And it was very successful. The students that attended it were really happy. And I think if we can put some more of those back in the schools, that's going to be helpful too.
Absolutely, absolutely. All right, well, our time is up. I just want to thank my friends and our community members, Ricky and Judy and Monica and Chris, for taking your time out of your busy schedules to come and talk about this important issue. And for those of you who are listening or watching from home, if you have any ideas of any stories for us to cover on this show or issues you'd like me to talk about or address, then you can go ahead and send an email to me directly. That's at Sarah with an H at CityofMidlandMI.gov. We really look forward to our next show, where we will be addressing another really important issue that impacts the lives of everyday folks like you and me, because it's always been all about people over politics. Thank you so much.
Thank you.